So now Julia Zell, OSDH General Counsel, will present the proposed emergency rules for consideration. Julie.
Just going to do for the board and the public a quick summary of the rules that were posted on the Oklahoma Medical Marijuana Authority website. These are proposed rules that we are presenting to the board for their consideration and possible approval.
So board members, our task by the board is to protect the health of Oklahoma. Anyone have comments to that effect about maybe some things that you're concerned about these rules, or things that we feel that we weren't able to go far enough and there might be some danger to the public?
Julie, were there some medical associations that wanted to have a pharmacist on site at the dispensaries, and that's not currently in the regulations as it's proposed now, correct?
Yeah, not only other medical associations, but other agency partners. And as we looked at that, I did not feel like we could get there under the law, but what we did do was this dispensary manager. And I worked with the Board of Pharmacy on that language, talking about what that person would do. Every dispensary would be required to have one, and that person would be identified when they apply, and they'd have very strict duties and guidelines that they would have to implement, as well as policies, supervision of employees, patient education, and things like that.
So you feel that us regulating that a pharmacist would have to be on site would be outside of our legal scope to be able to regulate
I do.
with this?
Yes.
Understood.
So that's one of the items on the list to go to the legislature next spring?
Yes, it is.
Okay.
Confusion. So I would like to see that we make some clarifications today, whether through an amendment or through, defining the real language, whatever, procedure we take. And I don't know, Chuck, if you want to add that as an amendment or
Dr. Christian, if I could say something.
Sure.
We aren't going to be issuing the initial licenses until the end of August. And so we could work internally to refine that rule language and bring it back to you next month, because it isn't going to be anything that's going to be implemented prior to the end of August. So we can have some time to be thoughtful with that language and bring it back to this board next month on those two issues.
More feedback from the
Sure.
hospital systems and the physician groups about those issues of federal versus state, and from the legal system to clarify so that we deliver them a safe product.
Absolutely.
Thank you.
We'll do that.
Thank you, Dr. Christian. What I hear right now is an amended motion by, we excluded 2 sections, correct? We've addressed 1. So do I hear any motions?
I make a motion to address the second in such a way that a pharmacist in good standing with the Oklahoma Board of Pharmacy and knowledgeable in specialized functions of medical marijuana product preparation, dispensing, including the safety standards and quality assurance, be a dispensary manager at these facilities.
Second.
And that's found under the definitions in 681-1-4. And you're also suggesting, don't let me put words into your mouth, but there's a sentence at the end that says a dispensary manager may also be a licensed healthcare provider.
May or shall?
It says may. So if
There's a
you're,
line struck through it, at least in the, yeah, that's been stricken. So my motion, that would be stricken.
is everybody clear on the motion?
Yes.
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 Question clarification. Could this also be accomplished through contract arrangement? Because I know that's done in some places. A full-time versus contracting with a pharmacist to provide these services on an as-needed basis.
So currently your dispensary manager has to be on site
40 hours a week.
and actually dispense. So you're tying a pharmacist to be at the dispensary. It's my understanding. Correct me if I'm wrong.
You're right.
And as I recall, Julie, in this matter, you felt it was, your legal opinion was that it was beyond the scope of the rules.
Correct. I think that this requires a statutory change in order to enact.
So Julie, for understanding, if we pass this rule as it's presented, and you're correct, and it requires a statute, what happens next?
Well, assuming that somebody challenges it, it would be challenged in district court, and there may or may not be a stay issued on either this provision or more. It just depends on what happens with the challenge.
Discussion?
I believe that many of the regulations we're discussing here, they are going to be challenged,
Amen.
no matter what.
Let's call for a vote, Diane.
Dr. Alessopoulos?
Aye.
Dr. Gerard?
Aye.
Dr. Graham?
Aye.
Dr. Krishna?
Aye.
Dr. Legeko?
Nay.
Mr. Osterhout?
Aye.
Mrs. Payton?
Aye.